Good morning, guys. Enhancing and restoring physical fitness and wellness by way of specific exercise instruction and education with regard to exercise and healthy living habits has been the cornerstone of physical therapy from the inception of the profession. And because of this, it is important for us to learn about health and wellness. Before we move on, let us have the following objectives for this session. First, we need to define the terminologies such as health, health promotion, prevention, and wellness. We need also to compare definitions of health and wellness, critique the definitions of wellness, differentiate between primary prevention, secondary prevention, and tertiary prevention. Also to differentiate the different six models of wellness and discuss the dimension and subdimension of the humanistic model of wellness. In its constitution, the World Health Organization defines health as not merely the absence of disease, it is a state of complete physical, mental, and social well-being. So actually, we have learned about this when we were still in our DPCS. So thus, the WHO views health as a triad of the physical, the mental, and the social states of being. It is logical to apply the concept of health as a triad when assessing wellness and health models, if not also medical models. So, we also have health promotion. Health promotion is the science and art of helping people change their lifestyle to move toward a state of optimal health. So, optimal health is defined as a balance of physical, emotional, social, spiritual, and intellectual health. Lifestyle change can be facilitated through a combination of efforts to enhance awareness, change behavior, and create environments that support good health practices. Of the three, supportive environments will probably have the greatest impact in producing lasting change. It can also be described simply as purposeful activities designed to enhance the health of oneself and or of others. So countless definitions of wellness exist. Halbert Tan is considered by many as the founding parent of wellness, defined it as an integrated method of functioning which is oriented toward maximizing the potential of which the individual is capable within the environment in which he or she is functioning. So Dan served as a public health physician and was the first nationally recognized U.S. medical doctor to explore the concept of wellness. A current leader in the arena of wellness is Don Ardell. So Ardell, who wrote the first mass market wellness book entitled High Level Wellness, offered several definitions of wellness. In 1985, he stated that wellness is a dynamic or ever-changing, fluctuating state of being. In 1986, though, Ardell added that wellness is giving care to the physical self, using the mind constructively, channeling stress energies positively, expressing emotions effectively, becoming creatively involved with others, and staying in touch with the environment. And in 1999, Ardell stated that wellness is about perspective, about balance, and about the big picture. It is a style or a lifestyle and a personalized approach to living your life in such a way that you enjoy maximum freedom. This includes now freedom from illness or disability and premature death to the extent possible, and freedom to experience life, liberty, and the pursuit of happiness. It is a declaration of independence for becoming the best kind of person that your potentials, circumstances, and fate will allow. So the American Physical Therapy Association, or APTA, in its Guide to Physical Therapist Practice, defined wellness as the concepts, that embrace positive health behaviors that promote a state of physical and mental balance and fitness. Because this definition excludes the social realm of the wellness triad, it is considered as narrow in scope and therefore flawed. Well, components of health are measured at a specific point in time. So, for example, a blood pressure reading or a Beck depression inventory score. Wellness is an active process that consists of habits and practices. And accordingly, in contrast to health, which is static, wellness is dynamic. An individual does not have to be healthy to be well. Individuals with acute or chronic medical disorders, including a terminal disease such as some forms of cancer, can be well as long as they are practicing a healthy lifestyle. Likewise, an individual does not have to be well to be healthy. For example, a person may be considered healthy if she or he does not exhibit any signs or symptoms of illness or disease, but that individual nonetheless may be engaging in unhealthy behaviors such as excessive consumption of junk foods. So although the emphasis of physical therapy is restorative care, it is within the scope of physical therapists to provide preventative care. Prevention services that medical practitioners or professionals, including but not limited to physical therapists, medical doctors, and nurses, provide can be categorized into three types. So we have primary prevention, secondary prevention, and tertiary prevention. According to APTA, primary prevention is defined as prevention of disease in a susceptible population or potentially susceptible population through specific measures such as general health promotion efforts. In the medical community, one definition of primary prevention is stopping disease before it starts. So, for example, immunization programs. Related healthcare professionals define primary prevention similarly. For example, we have the Association of Occupational Therapy, or the American Occupational Therapy Association, defines primary prevention as education or health promotion strategies designed to help people avoid the onset of unhealthy conditions, diseases, or injuries. Compared to secondary prevention and tertiary prevention, a concise description of primary prevention is pure prevention. An example of a physical therapist providing primary prevention would be he or she she is performing low back screening at a community health fair. So, according to APTA, secondary prevention is efforts to decrease duration of illness, severity of disease, and sequela through early diagnosis and prompt intervention. In the medical community, one definition of secondary prevention is early detection of existing disease before it becomes clinically apparent. An example is screening for hypertension. So, still according to APTA, tertiary prevention is described as efforts to decrease the degree of disability and promote rehabilitation and restoration of function in patients with chronic and irreversible diseases. The medical community defines it as optimum management of clinically apparent disease so as to prevent or at least minimize the development of future complications. An example would be the control of blood sugar level in people with diabetes. So currently, physical therapists provide primary, secondary, and tertiary preventative care. In the future, the provision of prevention services will expand as more physical therapy students and practitioners become educated in prevention strategies. So this provision of preventative care by PTs should include the integration of prevention measures in restorative care and direct prevention services. So next topic, we will be talking about wellness models.